Hello, fuelers. Welcome to the first day of Professional Development Boot Camp. You're helping us kick off a 3-day, 9 workshop virtual conference that's going to help you get better as a professional. My name is Corey Jo Biddle. I'm the Executive Director of Fuel Milwaukee and the VP of Community Affairs for MMAC. If you have any questions about boot camp or Fuel and what membership in Fuel means, feel free to contact me with the information I have on the screen. You can always go to the Fuel website and ping me there too. So as I said before, it's our first day. I'm so excited. Our first day of Professional Development Boot Camp, but this is the first time we've ever done this virtually. If you've participated in boot camp before, you know it's typically 5 days and 15 workshops, and we're like running all around the city, going to different places and meeting different people. This year we had to do it virtually, but we made sure that the programming was just as enriching as our normal traditional program. And it's easier, right? It's just easier to go to 9 different workshops if you want to, because we're not having to drive all around. So again, all virtual programs, and this would not be possible as always without our sponsors and the industry leaders and the speakers and all the folks that come together really to provide this as a gift. Boot camp this year is 100% free for anyone who wants to participate. So if you have friends who are in the Milwaukee region or colleagues and friends that are outside, invite everybody, because we want to show off our Milwaukee professionals and show them how we invest in our YPs, right? So go ahead and make sure you share this after this workshop, and we'll do our best to show off to the rest of the world. So today is not really a workshop. It's more of a morning of enriching, inspiring, a pouring into you of all of the gems and knowledge about leadership. The pressure's on, Dr. Raymond. Our mentorship morning, every boot camp, we start the mornings with mentorship mornings. So grab your coffee and get ready to enjoy some inspirational insight into careers. The reason why we chose Dr. Raymond as one of our speakers is because he's been so visible and such a trusted resource in our community as we're all sort of living through this pandemic together. And I just thought it would be really interesting to find out a little bit more of him, about him as a person. So all of the mentorship mornings, the whole purpose of this is just to give you access to a leader who's highly valued in our community and show you a diverse range of journeys. All of our leadership mentorship morning speakers have different backgrounds and different industries and different personalities and different leadership styles. And you're gonna see yourself somewhere in any of these conversations. And I think it's really important to show that diversity of what leadership really looks like. We wanna be able to see the patterns and traits that are common among leaders. So your style might not be exactly the same, but some of the habits and disciplines will be the same. And of course, we want to encourage and inspire you on your own leadership journey. This would not be possible, again, without our presenting sponsor, Marquette University's Graduate School of Management, who has been our partner now for, this is the third year running, and they've been a great partner as a presenting. I mean, they really make it possible for us to do this for our members and really all Milwaukee professionals at a really high level. So just a little bit about Marquette's Graduate School of Management. They have some interesting programs and offerings that will appeal to you if you're looking to go back to school or have an interest in virtual learning. So the Graduate School of Management is home to the nationally ranked part-time MBA and e-MBA programs, as well as world-class master's programs in accounting, applied economics, corporate communication, finance, management, supply chain, and they have several graduate certificates. They also have a joint MBA with law, political science, and nursing. So to learn more about any of these programs or how to apply, just go ahead to the Marquette website. I'll put the link down below. They have a lot of online sessions so you can learn and get an orientation of all of their programs. So thanks again to Marquette. Go in the chat right now and thank Marquette. Let them know how much you appreciate their partnership and assistance in making this program everything that it is. This year we have a new supporting sponsor, American Family Insurance. Do they say that anymore? That's what I remember from a kid growing up. At American Family Insurance, they understand that what it takes to make your dreams a reality is what they got, right? That's why they work so hard to protect your dreams and surround you with support every step of the way. It's also why they're committed to making Milwaukee a place of possibility for the dreams of all people, everybody, paving the way for a brighter, more equitable future through investment and initiatives in innovation, tech, and community. And we're the community part. So thanks again to American Family. Don't want to leave out our media sponsors, the Milwaukee Business Journal and Radio Milwaukee 88.9, who have been great, excuse me, great partners for us in spreading the word about what we're doing this year. Thanks to those media sponsors. We really appreciate you putting us out there. All right, now this is about you. We want you to get comfortable, right? So this is the opportunity for you to send messages to Dr. Raymond, ask questions in the chat, talk to each other, just interact. This is all about you. So the chat room is your domain. Feel free to go in there, discuss with each other, post questions, anything you like. Choose the presentation view that's right for you. And if any presentation polls pop up, feel free, just jump in. Don't forget, Q&A is always going to be the last 15 minutes of the discussion. For this session, we have a chat moderator who is my friend and colleague, Eric Kennedy. Hey, Eric.
Hey, how are you? Thanks for allowing me to do this.
Yeah, thank you so much for agreeing to do it. So Eric's going to be kind of in the chat room with you all. And if you have any questions that pop up, he's going to bring them to the fore in the last 15 minutes. So feel free to add him directly if you want him to ask you a question. So you see all of his stats, 40 under 40. He's an advisor to lots of YP groups, a volunteer, just overall. You know, he's just, I mean, I don't know what to say. I'm going to just give him the mic and let him do it. Just forget it. I'm gonna...
We're in this together, Corey.
We're in this together.
Being part of your crowd and your circle. So
Eric is the co-founder also of Elevation. So go check out his LinkedIn page if you want to learn more about that organization. It's really great. Thanks again, Eric.
Yep.
All right. Now, Dr. Raymond, you can go ahead and show your wonderful, calming, smiling face that we have all learned to depend on. I have so many questions for you about what it feels like to be the person that like everyone in Milwaukee trusts and looks to. But again, we chose Dr. Raymond because of his visibility and support throughout the pandemic. He's a noted leader in the medical industry, an undisputed go-to resource. He's been the CEO and president of the Medical College of Wisconsin since 2010. That's right?
That's right.
Yep.
Thanks, CJ.
He was the Milwaukee Business Journal Health Executive of the Year and the co-chair for the United Way campaign in a very difficult year to do that, and so many other stats that we'll get into. Dr. Raymond, thank you so much for agreeing to do this. Welcome.
Thank you. Glad to be here.
So I always like to start these discussions. Oh, let me see all the participants. All the participants go in the chat. Any questions you have, drop your questions right now. Drop your questions. Dr. Raymond, I always like to start these discussions really trying to find out like the origins of a person. And it's really interesting to me because I feel like so many of us in Milwaukee sort of know and trust you right now. You've been around, but we like so many people know and trust you now that it's just like, oh, that's just Dr. Raymond, but we don't know that much about your background. So I'm going to ask a couple of questions so we can kind of orient and picture little young baby Dr. Raymond. Where were you born? Tell me a little bit about your childhood.
Oh, thanks, CJ. I was born in Akron, Ohio, and my dad built tires for Goodyear. So working class family. And, you know, we struggled financially when my parents were young. My mom stayed at home to take care of the kids, and there were 4 of us. And we had a good, strong Catholic upbringing. My parents believed in the value of education. So we went to working class Catholic schools for all my grade school and high school. And I think that gave me a great foundation. And I learned a lot from my parents. They were there for us. My mom wanted to make sure that we all knew that she loved us, and she spent a lot of time with us, read to us when we were little kids, and it was just really wonderful. So, you know, I had a good start to life, even though in some ways it was relatively modest.
Well, so obviously your parents were one of your biggest influence. What do you think What are some of the biggest lessons you learned from them?
You know, my dad, who's been dead now for 12 years, just an amazing man. He put his family first and was honest. And, you know, I think I learned the value of honesty and integrity, having your priorities straight. And he really was there for his family first and foremost. And probably just a strong work ethic. My dad never had fewer than 2 jobs to try to support us and make sure that we were safe and comfortable. You know, from my mom, who's still alive and doing really well, just her investment, her personal investment in the children and in family left an indelible mark on me, one that I think is still important to me.
Did you have, like, was your overall extended family, did you have a big family, a small family?
Hey, listen, we were a Catholic family
Okay.
growing up in the 50s and 60s, so we had a big extended family. Most of the family was in Northeastern Ohio. You know, the highlights of our years were around the holidays when everybody got together. We always had a summer get together for the family, and that was just really, really important for us. You know, things are different now. People move around a lot more, and my family's all over the country. But
Mhm.
that was really a good part of growing up.
Yeah, it's the best part. I feel like it's the best part of growing up. And that's been hard this year with the family gatherings because my kids are 8 and 10 years old. And so they like, you know, Thanksgiving to them is like the cousins, you know, it's like being around all of our family and running around and having a lot of fun. Those are like the memories that help shape your personality and your ability to like relate to other people. So that leads me into my next question. I just thought about this one. Of all of the kids that were in the family, if the adults were sitting around sort of like describing the kids, how would they have described you? With like, you would have been like, oh, John is the blank kid.
The nerd.
Okay.
I like school maybe a little bit too much for some of my cousins.
Which subjects, what were your favorite?
I just love to learn, you know, I was a good student, so and things came easy to me. But you know, I just had a thirst for knowledge and learning how things work.
So when it was time for you to think about going to undergrad, did you know what path you wanted to take? What did you think you were going to do?
Um, Mostly, I grew up a big fan of Ohio State football,
Okay.
and I thought if I could go there, that'd be a good thing. And I wanted to go to a school that was big. And I looked at other schools and got accepted to some good schools like Harvard. But you know, I loved Ohio State, so that's where I went for my undergraduate. And they had wonderful honors programs with other eggheads or nerds that I could feel comfortable with, and got a wonderful education. And when I was looking at medical schools, I looked around a lot, was accepted to quite a number of good places, but I decided to stay at Ohio State. Just I was comfortable there.
But did you know, like, did you go in with a focus on science, knowing that you wanted to go into medicine?
I did, and you know, maybe if I had to do it all over again, I might go into business. But I got really sick when I was 13 years old. It turned out to be mono, and I spent a lot of time with our pediatrician. And I just thought he was a wonderful person, a great role model, and inspired me to want to go into medicine.
So if you could do it again, you would have gone into business. What makes you say that?
I like business,
Yeah.
and I'm pretty good at it. So, you know, maybe I would have been better at that than what I'm doing now. But you know, I just want to make sure everybody knows I'm very fulfilled. I think I made a great career choice. But we always, you know, look back and say, what if I could have done something different?
There's always these paths, right? You make a choice.
Mm-hmm.
So that's a good. I was curious about what does the CEO and president of the Medical College of Wisconsin do? Like, what is that role? I think people picture, like, I picture a doctor, but then I'm like, there's got to be the business side. Maybe that's why you those two worlds merge. Like, what is that? What is your job? Like, what does it look like?
It's pretty complicated. I mean, I do take care of patients, and until 5 years ago, I had a very successful, well-funded lab with doing I think, really good work. But I closed that so that I could focus on being the president of MCW. I don't know if people really understand MCW. We're over $1 billion of revenue every year, and we have 4 missions, and 3 of them lose money. And they're essential missions. We lose money on our education mission, our research mission, our community engagement mission, but they're part of what we are. And so a lot of my job is trying to manage the balance of the missions and make sure that everybody understands that even though we're a business and we have to work like a business, that we're not here to be a business. So it's easy for our people, our trustees, the community to focus on the healthcare side, which does generate a margin or profit for us that we reinvest in the other missions. And to balance that, and like a lot of educational institutions, I'm here to serve our faculty, our staff, and the people around here. I'm not here to sort of tell people what to do. So in many ways, I got 6,000 bosses that I'm responsible for. And believe it or not, this is not a particularly glamorous job. Usually when people are unhappy about something, they eventually find their way to my office. So a lot of it is sort of customer support or customer service, listening to people that are unhappy, they may not be at their best, and trying not to take it personally and to listen and make sure that I understand what they're saying, and there may be something for us to learn from that.
How do you keep from taking it personally?
That's a journey that I'm still on, especially now when there's so much stress, and MCW's had financial challenges because of the pandemic, and we're trying to lean in and address a lot of social issues, structural racism, health disparities, gender equity. So, and we've encouraged conversations. So there's a lot of lively conversation, and some of it gets a little bit tense. But you know, I always try to ground myself and just say it's a privilege to have my job. It's a privilege to have come from the background that I came from. It's a privilege to be a white man, and that I need to be strong and to do my best to get back to my community.
You say so many things that I'm not even getting to the questions I have here because you're saying so many good things. It's a privilege to be a white man. That is something that in the last year, many more people have been able to say with confidence and knowing and having experienced or even understand what that means. How did you come to that realization, and how have you been able to leverage your knowledge of it to help other people?
Well, I'm still on that journey. So I just want to say, you know, we all have to grow and listen to people. And part of my journey was really trying to listen and understand. And I would say that I have had many mentees who are not white men, women, African Americans, Asians, and try to listen to their experience and understand. You know what, I would just say it's been difficult for me because, as I said, I came from relatively modest background. In fact, the first 5 years of my life, we lived in government project housing. And so it would be easy, and I was guilty of saying, you know, everything that I have, I earned, my family earned. But I realized that's really not the issue. That even though I did invest in myself, my family did, that maybe there were doors of opportunity open, perspectives that people had about me that put me in a position where I could succeed, and those weren't open to other people.
That's so interesting. Thank you for sharing that. So speaking of mentees and learning from people, as you were going through school with a focus, you know, it seemed like you were pretty focused from the start about what you wanted to do. Did you have like role models or people that you sort of followed from a distance, or even had a relationship with them that helped guide you, you know, when times got tough?
Oh, so many different role models, CJ. And, you know, one of the things I want to make sure everybody knows is the value of mentorship, but you don't need just one mentor, and you may need different kinds of mentors depending on where you are in your life and your career. And also, I just want to make sure that everyone knows the value of your peers being your mentors, that you have a network, a group of people that are at similar stages of your career. So when I went to Ohio State and went to medical school, my my goal was to go back and be either an internist or a family medicine doctor in my hometown. I also wanted to challenge myself and go to the best place I could for my medical training. And at the time, there was a nice pipeline between Ohio State and Duke University. And Duke was sort of a rising medical powerhouse in the 70s and 80s. And so I went there and my perspective really changed. I met a guy named Bob Lefkowitz when I was interviewing for my internships. Bob ended up winning the Nobel Prize in 2013, but he was a faculty member doing interviews at Duke. And he told me, you know, you should aim higher. You should think about a research career. You should think about giving back to humanity in different ways. And Bob was so enthusiastic. He was really young at the time. I think he was 38, and just a real dynamic person. So I ended up matching at Duke, did my internship there, got amazing medical training, and ended up working in Bob's lab for 7 years while I was starting my own career. And so he was a wonderful mentor. He changed my perspective. He opened a lot of different doors for me. And at the time, if you wanted to have a leadership role in medicine, you needed to be a strong researcher. That was sort of the ticket. So Bob was a great mentor, enthusiastic, engaged, but not easy. He was tough. He always strove for excellence and insisted that we aim higher than any of us thought we could achieve. And, you know, said, if you stumble, get up and aim higher the next time. And he was not a warm and fuzzy mentor at all. It turns out he's one of my best friends now, and he's just been a lifelong mentor and a wonderful friend. But at that phase of my career, he was a great mentor. I had clinical role models that inspired me to go into nephrology. And again, in the 70s and 80s, that was really a very mysterious field. Kidney failure is still a problem for the US, and it's the only organ failure that we have where you have I think, an artificial kidney treatment that you can give 3 times a week and keep people alive. It's really cool and interesting and mysterious. There was a physician named Bill Yarger who was just an amazing clinician at Duke who inspired me to be a nephrologist. And again, to really be analytical and critical about the way that I think about science and clinical medicine. And also just a very fine person who was there for his patients. Listen.
So the nephrology the focus is on the kidney.
It is. So hypertension, kidney failure, dialysis treatment.
Okay.
And I could go on and on and on about other mentors. I've had some good mentors during the administrative part of my career. Even when I was at Duke, I wanted to be a scientist and a faculty member and a good doctor. But as I progressed in my career, I took on more and more leadership and administrative responsibilities. I ended up moving to the Medical University of South Carolina, ended up being the #2 person at MUSC. And my president, Ray Greenberg, just an amazing person, was a fantastic mentor for me as an administrator. He listened, he thought big, he was well-grounded in what his true north was, which is giving back to the community, investing in women's leadership. And, you know, we were in South Carolina, so investing in racial equity was something that was very important to him. And I learned so very much from Ray about how to establish what your own true north is and try to stick to your values.
When you started to practice, so you had a basis in medicine, whatever any doctor would have studied, in this research discipline. So when you actually sort of started off in your career, were you a leader already, or what? Like kind of explain to us how that happened. Like, what was your path to where you are now?
You know, I am a little quiet, and some people would say mysterious because I generally don't say very much. I like to listen. And I think because of that, even early on, maybe in high school, people looked to me for advice and my opinion, leadership. I did go into junior achievement and did pretty well there. It's a wonderful organization. But as I went through my career, I was given incrementally new and expanded leadership roles. And one, I guess, you know, for lessons learned, Aim high, set long-term career goals, but do the best job for the job you're doing now. And I always took that seriously, and lived in the moment, worked on what was important then, and you'll build credibility and show what you can do by doing that. And I guess that was something that that allowed me to have more and more leadership roles.
Did you ever take a leadership role or like take a step that you were afraid of?
Oh, CJ, every role I've been into, I felt like I had imposter syndrome. It takes a while to grow into a new role and to say, hey, you know, maybe I'm pretty good at this. Maybe I can do this. So sure, I think each and every job, I was frightened my first night on call as an intern at this 1,200 bed world-class hospital in Durham, North Carolina. I was afraid of the responsibility of taking on what now appears to be kind of a modest $10 million budget when I ran my first dialysis unit at the Durham VA. Yeah, sure. You have to grow into these roles. And if you're not afraid, or you're not asking, can I do this? You're probably not going to do a good job.
So good. So speaking of being unsure or afraid, let's get to, what was it, March of 2020, when we all got sort of hit with this new reality. Take us back to that time in your life when you realized, maybe you knew before the rest of us did, that this, you know, worldwide pandemic was on its way. How did you find out, and what were you thinking?
I guess it gets back to my background as having, you know, world-class clinical training at Duke, and you know, having spent years in the laboratory of a Nobel laureate, sort of understanding how to read the literature critically. So early on, probably the second or third week in January, I knew this was going to be a bad pandemic. You know, and I think it wasn't brilliant to see the struggles they were having in China and then in Italy, to know this was going to be bad. But it was frightening and somewhat surreal to see the false sense of security that we had in the US. So at MCW, I convened a task force in late January to say we have to get ready for this. We need to be able to protect our core business functions. We need to be able to deliver virtual healthcare. We need to be able to pivot our education enterprise to virtual modalities quickly. And we need to be ready. And I can tell you that even some of the best people here now weren't convinced. There were a lot of snickers and eye rolls. People had thought I'd gone off the rails. When I was at business meetings and I did an elbow bump instead of a handshake, people said, "What's that all about?" But I think we were well prepared for it. And I was perfectly happy getting ready for managing MCW. What we didn't know was that when the government shut down elective procedures, that we'd go from looking like we would have a $40 million positive margin for fiscal year 20 to $150 million loss. You know, just terrible challenge for us that happened. And I really had no intention of being the public face of medicine and science in Wisconsin. That just sort of developed naturally. We had a partnership that we were already developing with the MMAC, which, hey, CJ, you work for a great organization, amazing, with fantastic leadership. Tim Sheehy is one of the people I respect the most for his core values and his willingness to take a tough stand. And so we did a few webinars, and there were hundreds of people that were interested. Many asked very challenging questions. Some were hostile. And I learned that again, because of my background, I was pretty good at handling them, and tried to stick to the facts. Tried as hard as I could, at least publicly, not to be drawn into the politics of COVID-19, racial strife, all the things that were the economic crisis, and just tried to rely on science and fact. And so that role grew. You know, I haven't always gotten everything right. Nobody has a crystal ball that you can look into and predict perfectly what's going to happen in the future. And what I've tried to say to people is, if I was really good at it, I'd be playing the stock market right now. But you try to do your best. And by being unafraid to answer questions for the media, to try to respond respectfully to people that ask challenging questions. I think that established some credibility that grew as the pandemic went on.
It did. Like we watched it sort of happen, and you just became like, I felt at some point that I always knew that you were the one, and I'm like, wait a minute, I didn't know him, but it just really felt like I trusted so much what you were saying. So I remember I was having this conversation. This was pretty recent, where I was sort of discussing on Facebook the when the vaccinations started to be announced and given to people. There were a lot of people who were sort of, this, people were terrified, especially Black people. And I understood that because I understand the history and why the community is afraid of it. And I had made a comment about, that don't gaslight these people when they express that they're afraid. I understand why they're afraid. That was sort of my take on it. And somebody came into the comments and said, Dr. Raymond said vaccination is safe and I trust him. And I'm like, whoa, I trust him too. I will take it. I'm just saying it was a different conversation, but I thought that was so funny because people trust what you say so much. What does that feel like?
It's a huge responsibility, obviously, and but it's also an opportunity for me to show my values, to try to help by sticking to the facts and science, and by inspiring the people at MCW, that the 6,000 amazing people that work here, to lean into our community. And CJ, I'm so glad you mentioned vaccine hesitancy, and especially the well-grounded mistrust that people, especially in the African-American Black community, have about established medicine. We don't have a great history. And it's going to require that we build that trust, that we have trusted voices and faces advocating for vaccines, especially because African-American populations are disproportionately impacted by the health effects. There's more hospitalizations, more long COVID, and more deaths in African-American Black population than in other demographic groups. The economic impact of COVID-19 disproportionately affects minority communities and people of color, many of whom are essential workers and don't have the resources to be able to work remotely. They've got to be out there in public, exposed to people. So getting the vaccines into communities of color is a huge challenge, but it's so important. It's an opportunity for all of us. And if I could just ask all the fuelers today, please use your network to help people understand how important it is for all of us, but especially communities of color, to get vaccinated for COVID-19.
It's a wonderful message. I'll do my best, and I know all the fuelers will too. Everybody in the live conversation, and we'll send out a message to everyone who registered. Just spread the word and just talk to people. At least just have them start thinking about getting educated and answering any questions that they have. And it's okay to be afraid. It's okay to have fears, but there are answers, for those questions. So Dr. Raymond, thank you for saying that. So everything that we've gone through in this, just under a year, and all that you've faced as in your role at the medical college and in your role now as sort of this trusted voice in the community, what is the thing that COVID-19 and this pandemic, what has it taught you in general? Like what is the thing that you think, wow, I'm sure there's more than one, but if there's one that stands out, what's that thing?
Well, it's taught me a lot of things. Let me just start by saying that it definitely taught me that not everybody behaves rationally. And I'm very concerned about the mistrust of science and facts. I think it hurts our society, and social media is somewhat guilty. And it's challenging for me as a scientist to see people believe things that are not true just because it was on Facebook or Instagram or Twitter. And so that is very frustrating. But I'm going to go back to being well-grounded in values of leadership. This has taught me that you stick to your principles. Don't be afraid to say the facts, to try to avoid politics if you're a trusted figure, but stick to the facts, to communicate clearly and consistently, to listen, to not take it personally when people ask hard questions or maybe even hostile questions. It's an opportunity for you to communicate. And so I think, again, as leaders here, you're all going to have your own style. But for me, my integrity, my trying to answer questions as truthfully and honestly as I can has been important. And, you know, MCW still has challenges, and we had to furlough people. We had a few layoffs. But, you know, being able to just tell people, listen, this is hard. It's hard for me to do this. This is what I have to do, but I promise I'll communicate with you frequently and I'll try to answer your questions. I mean, I relearned the value, I think, of honesty and integrity.
Communication has been so important during this time because people are so unsure. So I'll combine. I'm going to get to there's a lot of questions in the chat. So this will be my last question. Advice, final words of wisdom, advice for leaders, a good way to encapsulate. I usually get a good answer when I ask this question. If you could go back and ask and talk to your 20 or 30-year-old self, what would you say? And then say it to us.
Wow. And I don't want this to be taken the wrong way, but, you know, one of the things I would tell my 20 to 30-year-old self is, first of all, I am a workaholic. So I need to admit that, and I'm working on it. But probably make sure that you continue to invest in your family, in your real life. Your career is part of your real life, but it shouldn't be all of it. You know, and I have a wonderful family and great relationships with my family, but, you know, I wish maybe I'd invested a little bit more time in my kids when they were growing up. Don't get me wrong, I was there for them, but to just live in the moment and enjoy being with them.
That's wonderful. Okay, Eric, come back on screen. All right, so now this is the portion where Eric is going to sort of pull out your questions from the Q&A. If you have more questions, go into the chat. Eric, I'll let you take the wheel here.
Awesome. So Milwaukee moment, as Corey, Joe, and I always laugh and talk about this. Dr. Raymond, I'm actually from Akron, Ohio. My parents are born and bred from Milwaukee. My dad, they both went to Madison. And just like you were sharing your journey, before my brother and my sisters were born and before I was adopted, they moved to Akron, Ohio. So my dad was a mechanical engineer and he worked for Bridgestone Firestone, so a competing organization for Goodyear. But I still go back there because I have family, but we're all spread out. But Swenson's, hopefully you enjoy Swenson and Luigi's when you go back there and visit loved ones. So very small Milwaukee moment that we're both from Akron, Ohio. I actually grew up as a Packers and as a Badgers fan. So when I attended college, I was the only Badgers fan. Everyone else was a Buckeyes fan. So I think 2 out of the 4 years we beat OSU. So it was really interesting times during that time. But anyways, was there someone that you encountered as a leader in your life who showed you the type of leader you did not want to be? So was there someone that you encountered as a leader in your life, but then showed you the type of leader that you did not want to be, Dr. Raymond?
Yeah, well, first of all, it's dangerous to talk about Swenson's ice cream fondly here when you're in Wisconsin, which is the dairy state.
Yep.
So that's pretty brave. But anyway.
Watch it.
Yes. And, you know, I don't want to name names, but I have worked with leaders who were bullies. They led by intimidation. They maybe weren't in it for values of the heart or the true north that I've been talking about. And I'm not saying they weren't successful in their own right, but, you know, I've seen that style and said, that's not me. I can't be that. I can't do that. I won't do that. And, you know, I don't know that those people leave a positive mark on their community. They may lead successful organizations, but I don't think that they necessarily inspire the best in the people that work there or leave a positive legacy on their community. you know, one of the things I want to do here is to leave a positive impact outside the walls of MCW in Milwaukee and the region. And I know a lot of leaders that don't think that way.
Awesome. What keeps you up at night and what gives you hope, not only as a leader right now, but also with everything going on and that we continue to go on right now?
Well, first of all, I sleep pretty well. I'm generally an optimist, although I'm careful about what I say. And certainly there's a lot to be hopeful about right now. The fact that we're having, even though in some ways it's been violent and difficult, a dialogue about racism is important for the future of our country. Same thing about gender equity. But these vaccines are our hope. A lot of people at MCW are saying our shot, and we need to take it for the future. I don't think people understand 95% effectiveness for a vaccine is unheard of. The seasonal flu, if we have 60% effectiveness in any given year, that's pretty darn good. And we're probably going to be living with COVID for a long time, so we're going to have to learn how to live with it. But this is one of our ways forward.
Awesome. What is your advice for those wanting to get into healthcare late in life? Because from what I've heard and seen, me being from Advocate of Rural Health, even some of the community members have said that I want to be a part of the healthcare movement and want to be a healthcare hero, not only because of the things that my friends are doing, but also Dr. Raymond, as Corey Joe mentioned, you've inspired so many with your knowledge and your professionalism and your insight and your genuineness. So what is your advice for those wanting to get into healthcare late in life because of you and because of others? And are there ways of making that shift gracefully?
There are, and I guess it depends, Eric, on what people want to do in healthcare. You know, one of the things I remind my own folks about, especially when we are trying to inspire and create opportunities for people of color to go into healthcare, of the 6,000 people that are working here, more than half of them don't take care of patients directly. And there are many health-related careers that people could contribute to: accounting, our supply chain, and others that we need to think about more broadly. But we have a 3-year pharmacy school. That's a doctoral degree that is very valuable and is taking on more and more important roles in frontline healthcare, that people could do medical assistance. So I'm hoping through our Thrive On initiative, which is a partnership with the Greater Milwaukee Foundation, Royal Capital Group, and 3 Milwaukee neighborhoods, Harambee, Halyard Park, and Brewers Hill, that we're going to be able to open some of those doors for people and not just inspire them, but to give them pathways to go into healthcare.
And just to reiterate what Dr. Raymond said as well, you don't have to be in clinical healthcare either. You can be someone like me who's in community relations. You can be in marketing. You can be in finance. You can be a lawyer. You can be a customer service rep. There's a lot of different fields for those that want to be a part of the healthcare movement. And you don't have to be non-clinical as well. So what is your definition of healing in respect to providing holistic healing in medicine, especially in these times of great suffering? So we look at probably mental health and how working from home and how that shifted from being in the offices. But what is your definition of healing in respect to providing holistic healing in medicine, especially in these times of great suffering, Dr. Raymond?
Well, I'm not sure I have a brilliant definition, but you know, part of what's made me a good doctor is listening and trying to make sure that you know the question behind the question, which isn't always easy to do, and it's a challenge for us. You mentioned we're all disconnected. We have invested a lot in mental health support for our students and our frontline providers, trying to stay connected to our patients so that we can deal with whatever issues they may have. But it is a huge, huge challenge. And it's harder because all of us in healthcare now are productivity driven. The margins are coming down. We all work for large organizations that if they don't have a profit, they can't reinvest in themselves, and they might not be able to serve their noble missions going forward. And the electronic health record also is a challenge for us. It takes the physician's eyes and hands off the patient, puts them on a keyboard and a computer monitor, and that's just really, really hard. So, I don't think there's anything brilliant here, but be humble, listen, know why you're there to serve, and make sure that you take the time to understand why your patient's there.
Awesome. Thank you. Where do you think healthcare is headed in the future? Not only the next year, 5 years, 20 years, and then 40 years from now?
Well, there are a lot of potential answers, but I do think virtual healthcare is going to become more and more acceptable. One of the things we found during the pandemic when we were providing virtual visits is pretty much everybody enjoyed them and managed to pivot, and that includes people over the age of 50. But when we resumed face-to-face healthcare, it was the young people who said, yeah, I'm fine with virtual. I don't need to come and see my doctor or my nurse practitioner. Folks over 50, not so much. So our challenge, and I know, Eric, you're seeing this at Advocate Aurora, is we have to serve different generations different ways. And so we're going to be delivering simultaneously. But I do see the future of healthcare being on your mobile device, people being able to have access to well-curated information from their mobile device at the tip of their fingers when they want it. But our challenge is going to be to make sure that information is well curated and that people aren't going to Facebook and believing the latest myths and rumors and misinformation over what the established healthcare infrastructure wants to tell them.
Yeah, awesome. What is your mission message that you try to live out every day? So what is your what is your why, and how do you help inspire and reflect? Because I know there's some good days, there's been some really bad days, but what is your why and your mission message that you try to live out every day?
Well, I think sticking to values. So again, I'm not afraid to talk about race and gender equity. I'm not afraid to talk about health disparities and the social factors that contribute to those. I encourage our people to do that. So show your values. But just on a day-to-day basis, being able to end the day when you put your head on your pillow and go to sleep and ask yourself, did I do something that made a difference today in the things that matter? And if you didn't, then to at least reflect a little bit on what you could have done better.
Awesome. And then one of the last ones is, because of what potential setbacks do you predict from businesses like Merck no longer providing or following through on the vaccine? So right now there are 2 FDA approved vaccines. So I know that Johnson & Johnson's working on theirs to get theirs FDA approved, but do you envision any setbacks on others that are trying to provide and no longer going through with it? Or do you feel good about the 2 approved and then potentially the Johnson & Johnson and any others?
Well, there are almost I heard there are almost 300
Yep.
companies bringing vaccines
Oh,
up. So some of them are going to fail. And some of them that got in late, like Merck, some of the big players are going to fail. China has 3 big pharmaceutical companies that are rolling out vaccines. And one of them, it might have been Sinovac, isn't doing particularly well in some of their clinical trials. So that's probably going to fall out. I'm very hopeful. We're going to have a lot of good vaccines. So the problem with Moderna and Pfizer is, even though the technology's been around a while, there's never been a mass-produced product that using the mRNA technology. So they're building manufacturing capacity. What's great about Johnson & Johnson, AstraZeneca, and maybe Novavax, which are, in my opinion, the next 3 that are going to get approved and come to market, is that their technology is about 30 years old, and it's been mass produced and used for other vaccines. So there's a turnkey manufacturing capacity that as soon as these vaccines are approved, we will be able to turn out hundreds of millions of doses in a very short period of time. So that's the big what if factor for us is, can we get Johnson & Johnson, AstraZeneca, and Novavax to market by the late winter or early spring? And I'm optimistic one or all three of them are going to come to market, and that we will be able to vaccinate everybody by the summer if we have our infrastructure built up to do the vaccinations. And for those three, it's going to be a lot easier. The vaccine's not fragile. It's got a long shelf life. You can store it in a refrigerator. It can be administered in a physician office, in a clinic, in pharmacies, very, very easily. So it doesn't pose the same logistical challenges that we have now.
Awesome. And then one last question is, when you're trying to, when you have identified a mentor or mentors and continue to do that, what is your best advice in trying to ask someone to be your mentor in a genuine and meaningful and purposeful way? And how do you continue to grow that relationship? Maybe it is just a 1 year, maybe it's just a 1 month, or just advice, but what is your best advice that you've envisioned and you've endured in growing and asking someone to be a mentor? Because it's almost, as Corey, Joe, and I will always joke about, it's almost like dating. Like you're trying to find the best person that instills the values that you have and what you want to do. And you're also trying to find that inspiring leader like a Corey, Joe, or like you, Dr. Raymond. But what is your best advice that you've learned over the course of the years in trying to attain a mentor?
Well, Eric, I've actually never asked anyone to be my mentor.
Oh.
What I've done and has worked for me is to ask questions and not be afraid to ask for advice, to watch and learn from how others conduct themselves. And as you pointed out, sometimes you watch and learn and say, I don't want to be that, or I don't want to do like that. In some ways, folks like that can be your mentors too. And again, I want to get back to try to learn from people, and that you may have lots of different mentors that are more important in different phases of your life.
Awesome. That's all I got, Corey, Joe.
Yeah, thank you so much. That's perfect time. And there's a couple of other questions in there about self-care, and there's some Ohio loves coming in the chat. There's a few other questions. I actually want to see Dr. Greer Jordan shared this, Dr. Raymond. She talked about this site as a resource that people could go to sort of answer some of these questions. Can you talk to us about the resources that you all have available, for folks to learn a little bit more or answer any of their questions about staying healthy?
Yeah, first of all, thank you, Dr. Jordan. She's one of the people that helped make sure my true north really points north. She's an amazing asset in the community. This Healthy MKE is sort of a matchmaker site. One of the problems with trying to ramp up all these vaccines and distribute them equitably is the people who have vaccine hubs, which Medical College of Wisconsin is one of 16 in the state, and have stood up vaccine clinics, which we do have at MCW, aren't necessarily in the places or have the connections for the people that need the vaccines the most. And so that site has a lot of resources, good science-based information about vaccine safety, where to go if you want to get a vaccination, and it's only getting better. So I would encourage people to use that site. Believe it or not, we used it. We stood our clinic up. We are able to do about 600 vaccinations a day, all volunteers at MCW, and we had gotten through most of our frontline healthcare providers. So we opened it up to police and fire and unaffiliated healthcare providers. And now we're trying to be matchmakers with hopefully people over 65 that are now approved. And going down the line, people in communities of color, teachers, the next groups that are going to be able to get the vaccines. And we want to be one of the sites, but that is your connector site.
So, and you're optimistic. I heard you on MMAC's called, I think it was our board meeting yesterday. Your optimistic view of herd immunity when we'll achieve it. I know people are wondering that. So Do you have any ideas about when we might achieve that?
Again, it depends on when the vaccines come to market. If we get one of the vaccines Eric was talking about, maybe by the summer, if we really can ramp things up. But it's 70 to 80% of people having received the vaccine. That's a safe estimate, and having a very low burden of disease in our community. So those are two things. Just getting the shot and having 70% of the people that got a shot isn't going to be enough. We're never going to extinguish COVID-19, but we have to get it down to manageable levels. Then we can resume some semblance of our previous normal life.
And we're all looking forward to that. Thank you so much, Dr. Raymond.
Thanks, CJ. Thanks, Eric.
Everybody in the chat, let's give some love to Dr. Raymond. Drop your notes of appreciation. Thank you for taking the time to do this. I know you have a lot on your plate, and I really appreciate you dedicating your morning, 1 hour of your morning, to us. And thanks to Eric Kennedy for moderating. I guess in this picture, he's holding a Grammy or something. I mean, I
don't know what it is, but I agree with Corey Joe and Dr. Raymond. Definitely get your vaccine. I've been honored and humbled to get mine as a non-clinical healthcare worker. And I definitely am trying to do my part to be a part of the herd immunity, but also to continue to mask up and social distance and wash your hands during this time. So
mask up, protect yourself, protect other people. Dr. Raymond, I learned that from you. So thank you so much for.
Thanks, CJ and Eric, and thanks to all the awesome Fuel leaders. It was an honor to be here.
You're awesome. I really enjoyed talking to you. So let me kind of get back to the slide so I can let you folks get back to work. I know you got stuff to do too, and I'm glad that you all spent your morning with us. Thanks to our sponsors, our presenting sponsor, Marquette University's Graduate School of Management, and our supporting sponsor, American Family. And we can't forget Radio Milwaukee and the Business Journal for spreading the word about what we're doing here. You have experienced the first of 9 events in our professional development boot camp this year. We're only doing 3 days, but it's going to be just as impactful. Take a look at the calendar again and sign up for other topics that you might be interested in. And very important, share. I need you to share this with as many people. In years past, we've hit 1,000 registrations by the end of the program. We're already at 1,000. We already passed 1,000 because it's virtual and it's much easier. I don't have to, there's no limits. I don't have to cut people off. This is the first time that we've ever been able to let anyone who's interested participate in this. So please share it with everyone. There is no fee. Please share it. Let's not waste this opportunity. Let's share. Sharing is caring. So at noon, we're going to be talking about myths and race in the workplace. It's going to be a really good session. Make sure you sign up for that and any of the other 9. And with that, I'm going to let you guys go. Get back to work. Thank you so much for all of your time and everything you've done. If you want a little bit of inspiration, stick with me and I'm going to show you this. Where is it? Where is it, guys? Have you seen the Milwaukee Strong video? If you haven't seen it, you got to see it. So let's have you watch it now. If I can get this thing to click. Okay, if you got 4 minutes and you want a little more inspiration and you like to jam, here you go. This is for you. Otherwise, get back to work and we'll see you later. See you at 12 o'clock.
Tomorrow will be a better day, 'cause we are proud of what we know. We are the good land, Milwaukee strong. ashes and the dust. We will rise, we'll all stand up.
With hope in our eyes, we'll go on. We will rebuild brick by brick, stone by stone.
Through the fire, through the rain, our tomorrow will be a better day. 'Cause we are proud of what we know. We are the good land, Milwaukee strong. Milwaukee strong like black coffee, yeah. Milwaukee black and brown, so please change policy, yeah. Milwaukee, let's work on ending poverty. Milwaukee growing, let's make sure that we grow it properly, yeah. Milwaukee home, so let our love show. Milwaukee special, invest in the homegrown talent. We all searching for balance, united the good lands, approaching all of our challenges. Hand in hand, you and me.
We're working together like a family. Together we stand through it all.
Hand in hand, standing tall. Every day, in every way, spreading love, the Milwaukee way. Loud and proud, through and through. This is who we are. This is what we do. Through the rain, our tomorrow will be a better day. 'Cause we are proud of what we know. We are the good land, Milwaukee strong. We are the good land.
We are the good land, Milwaukee strong.
God bless the good land, Milwaukee strong.
Milwaukee strong.
That was great.
That was so good. I love it. I never get sick of watching that. I don't know why they didn't ask me to be a part of it. American Family Insurance. See? Get back to work. Thank you, guys.